Today with Dr. Klein, we're talking about holistic medicine. And in previous conversations about this we've done on the radio and we've done on these small segments, is I always like to start out by saying, I don't think that the general public has any idea what holistic medicine's all about. I think they think it's a whole bunch of voodoo that came here from Africa or something.
You bet. Okay, the reason for this little discourse today is to try to shed a little bit of light, if at all possible, onto the different words that we use to describe medicine in our country. Allopathic medicine is what most doctors use. That's what they practice. Allopathic is the description that doctors use to describe what they do. But it's not the only descriptor that's important. Okay, allopathic is interesting. Naturopathic is very, very different. That's a little bit frou-frou-esque and can be a little bit weird. These are individuals that see medicine very, very differently than your family doctor. Then you're looking at things that are holistic. Now, what's a holistic doc? A holistic doc could be a naturopath. A holistic doc could be an allopath. A holistic doc is somebody who looks at the whole picture. Okay, what does this mean? This means that they step back, look at you as a person in context. We used to call these family doctors. Okay, a family doctor was somebody who did holistic medicine. These are not hippies. These are not flaky sorts of individuals. They're people that look at your entire medical history. They look at your medical condition. They look at what you're doing, who you're doing it with, what your job is all about. They're supposed to be part of your family. Yet that seems to be disappearing. They are now more like the halfback, in football than they are the coach. What seems to happen is they get the ball and hand it off to somebody else to run with, or the quarterback to throw it to somebody. It doesn't make any sense any longer. So the family docs used to be the hallmark of holistic medicine, and now that has changed conveniently.
If people think back to Little House on the Prairie,
Marcus Welby
came to the house, sat down, got to know your home, got to know how many stairs led up, went to your workplace. Is that the holistic doctor?
Used to be.
Yeah.
Okay. It's very hard to do that now because of the constraints that we're under.
Sure.
So very, very few people even have the time, let alone the interest to do that. But you can still do what you can do given the information at hand. The electronic age makes it a whole lot easier to be able to get into people's head, to get into their life, to figure out what's going on. You can do an awful lot of research with your laptop computer. All you have to do is look at their Facebook page. You'll learn a lot about people very, very easily, and we do that in practice. Why? Because those are insights. As soon as you go to somebody's Facebook page because you're wondering why they might be depressed, you find out that their parents passed away, or you find out that they're having domestic issues, or you find out that there's something else going on. And it makes a huge difference when you're treating families. It makes a huge difference when you're treating a patient. Holistic medicine is the practice of medicine whereby you look at all organ systems at one time. This is important. Why? Because you're not a summation of a bunch of different systems. They all work independently, yet they all work dependently. There's no point in being looking at somebody's nervous system without looking at their endocrine system. There's no point looking at the endocrine system without looking at their immune system. There's no point looking at the immune system unless you're looking at the cardiovascular system, and so on and so forth. So going to a specialist, which is something that you very frequently have to do in order to work your way through certain types of disease states so you can know what the most current thought is on a topic. But at the same time, what you're doing is you're looking at the least practical approach to figuring it out. By going to a cardiologist to treat somebody with fatigue could make absolutely no sense. Mm-hmm. Why? Because after all, to a cardiologist, your entire life is a muscle the size of your fist and a bunch of arteries and veins that come and go from it. That's what you're all about. It doesn't tell you anything about why you might be fatigued, why sleep may have become an issue, why the depression that you're having may become more of a problem, why you are having difficulties at work, and could the fatigue have something to do with your shift work? Okay, if your doctor isn't interested enough to know what you're doing for a living and how you're doing it, it makes it very difficult for people to draw the right conclusion when there's an issue. So what is holistic medicine? It is not frou-frou medication where you're throwing herbs over somebody and shaking a chicken over their head. It's not that at all. It's simply an understated view of medicine as if you were looking at the whole person in context. So to call yourself a holistic doc, okay, holistic medicine is really rather presumptuous. Okay, it has to be done somewhat tongue-in-cheek, okay, because that is exactly what everybody is supposed to be doing. All physicians are supposed to be looking at everything in context. When you go to medical school, okay, they don't teach you, okay, you're going to go out of here and all you're going to know is this one narrow field of medicine. Okay, they teach you the whole thing.
Mm-hmm.
Okay, you start at the beginning and you're supposed to continue the rest of your life. When you go into residency, you're supposed to specialize. That doesn't mean that you forget all of the other medicine that you practice, that you were taught. So if you're going to the orthopedist, okay, with a hip injury, or you go into the orthopedist with a shot hip, okay, if he's not looking at your endocrine system to figure out why you've got a broken hip or why you have one that's worn out, that person has not done their job particularly well. It certainly wasn't the way they were trained. It may be the way the practice has evolved, but it certainly isn't necessarily the best medicine. So, well, gee, I've got 2 bone-on-bone knee issues. Well, did this individual, the orthopod that you went to see, go in to figure out why? Did they have a little chat with you with regards to your weight, which is what caused the knees to go bad? Did anybody talk to you about your hormonal status, which caused the bones to weaken, thereby changing the angle with which they're articulating, thereby damaging the cartilage, leaving you in the condition that you're in? What do you think putting some stainless steel in there along with some Teflon is going to change your life? It might make you feel better for a few years, but it's not really changing the underlying issue. Going to the cardiologist and getting a statin, you think that's really necessarily going to help you by lowering your cholesterol? Why? What does cholesterol do to you or for you? And under what conditions should this be done? It's not a number. You have to look at the entire clinical picture. You have to look at you in order to know whether or not something is meaningful or whether it even needs to be addressed at all. It may be very healthy as it turns out. What's a normal blood pressure? Okay, we know what abnormal is. Okay, once it hits a certain state, tissue damage begins. But what is a normal blood pressure? It may be very normal for you to have a blood pressure of 90/60. If you're not getting dizzy when you're walking or standing up, then it's probably very healthy. You don't need to be worrying about things that don't need to be worried about. But with holistic medicine, you're supposed to look at the whole patient, step back, and then deal with them with regards to the underlying medical conditions that may or may not occur, and those that are likely to occur, those that are destined to occur, those that are going to be self-inflicted, and those that will be environmental. And that's what holistic medicine's about. So if you look at somebody and they're eating poorly, okay, well, guess what? You can throw whatever medicines you want to at somebody, but unless you figure out how to intervene effectively to get people to do what they need to do, you're not doing proper holistic medicine. And that's really what this is all about. It's not a brand, okay? It's not a copyrighted description. It's not a trademark. Holistic medicine is a concept. It's a philosophy that you look at the whole person. In fracture pieces, nothing makes any sense. So if you want to look at the whole picture, look at the whole picture. If you want to look at a jigsaw puzzle one piece at a time, then you get a general idea what I'm talking about. When the jigsaw pieces are put together, you can see the picture. Until then, you may not have any idea what each piece represents or where it is in the puzzle. Holistic medicine is the study that involves looking at all the pieces at one time, making sense of it and pushing it where it needs to go, moving the ball downfield, to use a sports metaphor. What you're trying to do is to make a difference in somebody's life, hopefully for the positive, okay, by taking incremental steps, by looking at what needs to be done, what needs to be avoided, and so on and so forth, and taking appropriate action.
Sometimes it's as easy as a doctor walking up the hall and hearing a patient cough.
Doesn't take
and
much.
Discovering whooping cough.
Yeah.
You just never know. But the doctor has to be listening.
Yeah, the doctor has to be there. The doc must be there. My first physician interaction when I moved to this area, okay, I never saw the doc. All I saw were the assistants. And when I said, hey, look, I'm a physician. I'd like to meet the physician that I'm here to interview because I want to be a patient here. Well, the doc doesn't see patients.
Wow.
Yeah, I've not, in 17 or 18 years since I've lived in this area, ever referred to that practice.
Disconcerting at best. stagesoflifevitamins.com. That's a great program for you to get enrolled in. You get your nutraceuticals on time every time. SufferNoMore.com is all about the stages of life. At 1917 Booth Circle, here's more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you. We will